Welcome back to Medical Monday, guys. We're going to be talking about a very near and dear topic for Dr. Gabby. We're going to talk about low back pain.
Low back pain.
Very important topic because there's about 231 million encounters a year of patients coming in to the healthcare provider asking for help because they have low back pain.
And you know what? That's great news for us because our mission is to get 1 million people out of pain off pain medication and avoid surgery.
There's a lot of options out there for us.
So I like hearing that.
So it's a very concerning problem because it also can be acute and long-term depending on how the treatment goes as well as patient compliance with the treatment.
Very true.
But when somebody tells you they have low back pain, where's that really at and what does that entail?
No, the low back is the very midsection of our spine, but it is the lowest part of our torso area. So as you can see here, there's a lot of different regions to the spine. The low back area is this red highlighted area you see here. And so it's the very lowest aspect of the loose vertebra in our spine. It's where our ribs end and our pelvis begins. Those are a lot of different ways to describe it where you are.
We call it our lumbar spine.
Our lumbar spine.
And you hear that with lumbar support in a vehicle, that bottom portion, kind of right above your hips.
Exactly.
But obviously, like she said, a little bit below your ribs.
Yes, and there are 5 movable bones that stack on top of each other and 4 discs, although there is one above and below when we talk about all that. So there's a lot of technicalities, but we're trying to keep it very basic for everybody to understand.
Because this is the most common, you know.
Yes,
it's not
that
it's basic so much as it is common. Mm-hmm. We have people with neck pain, thoracic pain, the middle region, but the low back pain seems to be the most prevalent and oftentimes the longest lasting with what we consider chronic pain.
Yes, it is. And it's from just old injuries, but we're going to talk about that. The one thing I want to hit on is we are talking about and have shown what's called the skeleton, the bony structures that are involved in the low back when we talk about low back pain. The thing is a lot of people don't know there's actually a lot of musculature involved in this as well. So when we talk about low back problems, we're not just talking about the spine and the structure itself in regards to like the framework of it. We're talking about the soft tissue, the muscles, the ligaments, the tendons, and there's layers and layers and layers that exist to support that spine and those structures. So there's a lot to it.
A lot of options of why you have this low back pain.
Exactly.
It's not always just the spine. It's not always just the soft tissue. Most of the times, it's a combination of both.
It is. It's a combination. And that combination can come from a lot of different aspects. We have a lot of patients that are very active, but sometimes it doesn't matter how skilled you are. Sometimes we make mistakes and we lift that one thing that we've lifted a million times the wrong way that one time that we did it, right?
And we see this, you know, this is kind of a common thing that you would think about with low back pain is lifting something heavy. However, oftentimes we get patients who are just turning to get their toothbrush in the morning. It can be something simple and lightweight.
Simple.
It's all about the posture of how you do it. See how she's set up for the correct way and the wrong way to lift. And that goes from a toothbrush to, you know, a 200-pound squat.
Yep, it's very true. A lot of aspects there. The other aspect is, you know, she's bending to pick something up. There's a lot of other aspects to our spine that are involved. And not just spine, but extremities. Is it the hip? Is it the low back? Is it the hip? Is it the low back? Is it the musculature between?
Oftentimes it's both.
Yes.
A lot of times patients who have hip pain, they don't walk the way they're supposed to, so therefore they have some inappropriate movement of the lower back and they get low back pain. Or people who have low back pain because they're hunched over, now that weight is too heavy on the hips and now the hips start hurting. So it's kind of the chicken and the egg, which one happened first. Oftentimes patients, if left untreated, do show up with both.
Yep. Oh my God. But then also we have old injuries, right?
Correct.
When we talk about the chicken or the egg, well, the old injury happened a long time ago. We'll call that the egg. But then the eggs got to eventually hatch, right? So we have an old injury. We've never taken care of it because we've just always been able to recover.
Doesn't hurt that bad.
I'm still young.
Yeah.
Right?
I'll just walk it off.
'Tis just a flesh wound.
Yep.
Yes. Well, sometimes those come back and catch us.
And we see that with, you know, these chronic injuries, continual disease process when we talk about scar tissue of kind of how the body heals when there's damage. It doesn't always heal correctly. You know, when you're cut, like on your hand, it doesn't heal with the same tissue. So same thing with your back or any type of muscle. Whenever you tear those muscles from some sort of injury or accident, just falling, it doesn't always heal to be the same strength as a previous tissue was.
Very true. Very true. And that's when we start seeing the degenerative process occur. We talked about the muscles. The muscles support the structures. And by structures, I mean the bones and the joints that move. Muscles move joints. That's why I can take my bicep here and my arm. And
You're just showing it off. You just showing off this.
I can move my elbow, right? So the thing is, that muscle allowed me to move that joint. We have muscles in our spine that allow us to move the way we can. All right. Yeah. So when those muscles are not engaging properly due to the scar tissue you're talking about, we see these types of processes occur. The disc space will change. We'll see different types of arthritic changes that occur. So, and then it affects the movement of the joint. So there's a lot of different things that can happen through different types of injuries, how old, how new, all those things. So there's a lot of different processes. The thing is, take care of it now. Even if it was from 20 years ago, take care of it now because there's no better time.
Yeah, those muscles that move those joint spaces in there, if they don't move that fluid around the way it's supposed to, that fluid will go away. And that's where you see the issue of that deterioration in there. It's just because the fluid's just not being moved the way it's supposed to or enough.
Correct. Very, very correct. So let's say for a scenario, I've recently tweaked my back. What is something I can do at home in hopes that I do the recovery, that I'm able to get better the way I need to do?
4-step process with any type of injury. I know today we're talking about low back, but there's always a 4-step process with any type of injury. First, be like this little piggy right here and take a rest, i.e. don't continually reuse that muscle that hurts. If it hurts to move, you should not be doing it. Acute injuries, you always want to use ice. That helps bring down some of the swelling, we say inflammation. And then, of course, you want to compress it. So just a simple wrap or even just a heavy, I know they have weighted blankets now, which are very good. You can actually utilize that with your ice pack to place on your lower back to give you a little bit of a compression feel there. And the last but not least is elevate.
Elevate. Yes.
That's not the way you want to elevate, but you could do that.
Oh, okay.
Yeah.
I Googled it.
Normally when we say elevate, we're talking about like the injured area, like a foot or an ankle. But even in the aspect of the low back, you'd still want to be in a slight recumbent position, like a recliner.
Almost like a recliner, exactly. Yeah, just a comfortable position to allow your body to recover and in a less tense state. That's exactly how that works. So those are some things you can do at home if you have a recent injury or if you re-injure something that you've experienced in the past. The thing is, sometimes we discover we don't recover as quickly as we used to.
Unfortunately, that is the case. Yes. So then what do we say? Let's go find somebody.
I'm going to go to my doctor.
Who's going to give me some help that I need?
Yep.
Well, with low back pain, what we see traditionally is what we need to do is rest the pain area. And how we do that is with muscle relaxers, or we can actually do that with medications to block the signal to the brain that's saying, hey, I'm having pain. And that is what's utilized most often to try and help with back pain. Another thing, too, is if you went to your primary or an urgent care, they're also going to recommend the same thing that we all do is for rehab because you hurt your back for a reason. Yep. So taking a pill to stop the pain is only going to go so far when you get to the root of the cause of what caused the pain and what can we do to have it not come back.
Exactly. Rehab is very important in strengthening, and that's what's great about when you get the muscle relaxers or certain prescriptions. They allow you to get through that process more efficiently and more comfortably. So it is a caveat.
Or some people to push through or injure themselves worse. So there's kind of a double-edged sword there. You got to be very careful and explain everything to the patient so they get well taken care of.
And then sometimes it persists for a little bit longer, or your discomfort and pain is actually pretty extreme. So then sometimes they'll refer out for a specialty procedure, like a steroid injection directly into the joint space. And so this is fairly uncommon, but it is done quite often, and the results are not always as expected.
Two different types of pain management. Yep. The first pain management is with medication. Now, this is another type of pain management called interventional pain management, where you can go in oftentimes from an anesthesiologist or somebody who's fellowship trained to actually do injections into the lower back region to the spinal region, and then usually do it under anesthesia. So that means you would have to go underneath the anesthesia with a very prolonged time. It's a very simple procedure, but it is right into the spine there and directly onto that nerve to help relieve some of that pain. Patients refer to it as a lumbar. They've said lumbar steroid injection or epidural injection, lumbar spinal injection. A lot of times it's kind of referred to multiple things, but that's
Yes.
exactly what it is to help relieve that pressure on that nerve.
Mm-hmm. And then what happens as well is sometimes we have chronic pain that's existed for a long time. We've ignored it. It's literally gotten to the point of no return. It's gotten to the point to where, we lose sensation. There's a lot of different symptomology that comes behind when we talk about these things. But sometimes surgery is necessary. Truthfully, this can most commonly be due to trauma, typically some type of major accident or injury that's broken something or torn it in a major sense. But really, degeneration-wise, if you don't take care of it, it will continue to progress.
Yep.
And sometimes surgery is necessary to stabilize that area and make sure that you can still function and do what you need to do.
And that's rather the unfortunate thing about low back pain. The number one predictor of acute versus chronic low back pain is activity aversion. So if you hurt your back, you don't want to move the area when it hurts, but you still want to move and be active. Because if you're not moving and active doing rehab, that's the number one predictor of you having chronic back pain that now can definitely lead into those long-term effects of possibly having back surgery.
Yes, and we don't want that. We
Nope.
want you to do the things that you love. That's exactly what it is.
So part of doing those things that you love is being movement within those muscles. Those muscles, if you've ever hurt your back, you may have felt them tighten up. They're kind of protecting you, but they're actually not helping you recover. Mm-hmm. So what we can do here is you'll see trigger point injections right into the muscles that are very tight and locked down. We want to relax those muscles.
Ooh.
Relax those muscles so that they can do their job, move the spine. We can do that with rehab, better rehab. We can do that with better adjustments because you've relaxed those muscles. You're not fighting against something.
Yep, exactly.
It's always hard to fight against, something. But if you just relax it, it makes it very easy and it does its job like it's supposed to.
Yes, absolutely. Those trigger point injections help patients respond so phenomenally through their rehab exercises because it makes them more comfortable through that process. And then also through the adjustments, there's a lot of recovery there. So one of the things we utilize for just about every case that comes in here is rehab. There's typically some type of strength deficit that exists. There's an imbalance between one muscle group versus another. And so we make sure we balance that out. So rehab to make sure that we utilize every muscle group necessary to engage those muscles. So you can see our rehab mats there. Lots of stretching involved. Typically everybody's tight.
And that's a part of it. We see these muscles are connected to the low back, to our legs and our pelvic region. So when we're really tight in our legs or pelvic region, that tells us those muscles are very tight and pulling on our back, which leads to dysfunction, which leads to inappropriate wear, which leads to low back pain and discomfort. So oftentimes there's two big things in rehab. You've got to be flexible and you've got to have strength. And we also see that when somebody has an injury, it's because of one of those two things are not being met. Or sometimes both, but...
Yep. And it just depends. Everybody's a little different.
Yeah.
We also do lumbar decompression. So
Perfect.
important to be able to open up that joint space. So these chairs are specifically designed to open up that joint space and get pressure off of those nerve roots. Now this is dramatized, but there's a lot of movement that can exist in there, and we need to make sure that we pump it to get that fluid. You talked about fluid. The muscles allow the juices to flow.
Yep.
That's exactly what this is specifically designed to do, is get that movement in those specific joints in the spine so that we can get pressure off nerve roots, get those structures moving again so that you can function and strengthen. That's so important. And then also adjustments.
Yes.
That's the magic that happens table side. So we do specialize in a lot of different techniques to make sure we get the best movement and alignment of the spine. We rotate our tires in our car because I don't want to go down the street like this unless it's a rough road.
Yeah.
But even then, we need to make sure that the alignment is there so that as you move to function, to get back into those activities, you're supported properly and that movement happens. And we have a lot of different tools we utilize to adjust through that process to make sure that it's the most effective and most comfortable adjustment for you. So
you're one of the 231 million encounters this year with low back pain. I hope you've learned a lot. I hope you see some of your options, and I hope you see that there's things that you can do to prevent it and to take care of it at home. But if not, there's options for you, and I hope you learned a lot today.
Yes. If you know somebody that has low back pain, share this message with them so they can learn more and start doing some things at home.
One thing that really helps is I know if you click like or share this video, it can reach more people, more friends and family. And if you like the video and subscribe, then you will get our next Medical Monday.
Yes, you will.
Right to you, so you don't have to look for it.
Yep, and we know that you enjoy watching your Medical Mondays. So until next week, y'all all have a great day.